Good afternoon and welcome. My name is Shalonda Griffin, and I'm a community relations coordinator here at Gifts of Life Michigan, where we honor life through donation. And I'd like to welcome you to Let's Talk, where our theme today is going to be health literacy and accessibility. And we are going to be joined by two very knowledgeable guests. One is from Hurley Medical Center here in Flint, and then the other is from Molina Healthcare of Michigan. And as always, we welcome your questions and comments. So please feel free to type them in the chat. We cannot wait to hear your thoughts and we will answer them as best that we can. So I look forward to our time together with our guests. It's going to be great. And I'd also like to encourage you to like and share this video. Please share this with other people who are in your community. All right, so I'm very excited to welcome our very first guest today. Her name is Tarnesa Martin, but she is affectionately known as Nurse T by the community, and she serves as Hurley Medical Center's patient resource and community advocate. And her mission is to help improve the patient, family, and community healthcare experience through donation, support, and advocacy. Nurse T, how are you today?
Hi, thanks for having me on. I am doing just absolutely wonderful. So glad for this opportunity.
Fantastic. Thank you so much for being here today. I'm excited to talk to you. Can you please tell us a bit about your healthcare background?
Yes, I have been a nurse, believe it or not, almost 22 years. I started out as a nursing assistant at McLaren Hospital for 10 years, and then I was inspired to transition into the role of a registered nurse. So I went back to school and then I started my actual nursing career at Hurley. I've been in multiple roles at Hurley. And prior to the position that I'm in now, the patient resource and community advocate, I was a supervisor. I was a nurse manager of a real busy med surg unit. I have experience in case management. I have experience in addiction. I used to work at the Odyssey House. I've also was the first one to hold the phone for the rapid response team. I've taught at both Baker College and U of M as a clinical adjunct instructor. So I just have a wealth of knowledge and experience that have empowered me to be in this role today.
Yes, it sounds like you are very well versed in all things health. So you work as a patient resource and community advocate at Hurley Medical Center here in Flint. Tell us what that means. What is your role?
My role is to advocate for the community as far as healthcare concerns. It was a grassroots position that was created about a year and a half ago after the pandemic. The hospital administration team knew that there needed to be something that needed to be done to reach the community. We had 5 top medical conditions that was severely impacting the Black and Brown community, which was heart failure, diabetes, stroke, COPD, which is chronic obstructive pulmonary disease, and kidney disease. And then we have a lot of resources, but somehow the community was not receiving them, or they was just not aware. So a boots on the ground position was created to be able to go out and serve as a community health educator, to help prevent disease and also to help with disease management and connect the community with resources and information so that we could reduce healthcare disparities.
Okay, now I see you out pretty much every single day. You are a very, very busy woman. Tell us what some of your responsibilities look like. Do you reach out to organizations to come in and talk to people, or how do people get in contact with you?
So it's a little bit of both. So I reach out to organizations. I go to community events, and a lot of times I receive calls or emails. But when I first started in the community, before the community, really understood what my role was, or basically they didn't have an idea of why I was coming out into the community, I had like a listening session, and I was asking the community some questions, and what would they like to see. And one of the concerns was consistency and visibility. Because at first, because of the mistrust in healthcare, they didn't at first just welcome me out in the community. So the one thing they asked me to be was consistent and be visible. So I took that to heart. And so whenever they had any type of outreach event, or whether it was in their backyard, their block club, their basketball games, if they invited me or if there was an opportunity for me to set up a healthcare table and share health information, I made sure that I was available and I prioritized that.
Okay. So, what does a typical week look like for you?
A typical week look like for me is getting up early in the morning. I'm checking my schedule. I'm listening to, we have an emergency call every day, a huddle that gives us all of the information that goes on at Hurley. So I'll know what to connect the community to. Drive into my center row office, loading up papers and books and everything and that I need to take out at my table, going to the event, setting up, sharing information, educating, leaving there, then going somewhere else. Or if there's some community event or somebody is having something, me showing up for support. A lot of times I get calls to come in and educate on other medical conditions other than the 5 that I'm responsible for. But because it's an identified health concern, I always take that opportunity to educate. So my days are very, very busy, but I can say that it's rewarding. It is very rewarding. And then partnering with other community organizations. So.
Okay. I really admire your dedication to health literacy. When I say that I see her everywhere, I am not exaggerating. You even have an online show that you're a part of for people who maybe aren't getting out and going to these events. Can you tell us a little bit about that too?
So what that is, I think in my old life, or I always had a dream to be a reporter. So now what I do is I just come on and I just say, Nurse T reporting live at whatever events that I'm at, or I'll come home and share the information so that if any community residents were not able to come out, I will make sure that they get the information, because the key is access. Making sure that all 4 corners of Flint have an opportunity to hear healthcare information, because when they don't have access to the information, that's what creates the disparity. So I'm real big with the health literacy and the equity piece. But the thing about it is, how do we do our part as healthcare providers to mobilize the services? Because we know the social determinants of health, like the barriers is the transportation, the housing, the food. They may not have an opportunity or have access to receive the information. So what I try to do daily is prioritize and try to figure out any kind of way. And when I say any kind of way, I mean any kind of way that I can get health information to the community. And that's why you see me at various places, which are probably non-traditional. So if you see me at your son's basketball game with a table, it's because that's an opportunity for me to see you and you walking by and I'm like, hey, come over here. You know about heart disease, so you can educate you and your loved ones. So in case of an event or anything that's happening, you would know signs and symptoms, you would know your risk factors, and you would be able to make a well-informed decision.
I love that. Now, how do you help break down health literacy to the average person? Because I've been in situations where I've had medical professionals talking to me, and sometimes I think they forget that I didn't go to medical school. So when you're using these 15, 16, 17 letter words or the Latin definition of it, that goes over my head. I don't know what that means. So how do you break health literacy down for the average person?
So basically, by keeping it simple and keeping it relatable. One thing is that I love to speak and empower people. So like, say, for instance, if I'm educating on the heart, a lot of people know that have heard me speak about the heart. They know that the heart is the queen. And so the queen is the regulator. So she regulates and she controls everything. So she's the most important part. So when I talk about the heart, I talk about the heart as being the queen. And like, if you don't have your heart pumping healthy, and then everything shuts down. Now, if I'm educating on kidneys, I talk about the kidneys as being the king. because you got to have the heart and the key. So it's just any simple ways to where the community can grasp hold of the information. And then sometimes there's opportunities as well to I mean, to educate in a way where they can understand by definitions. I'm real big on if you can define it, you know it. And talking in stages and in levels. Like for instance, when I talk about sepsis is huge because it can play a significant part in with kidney disease and with heart failure, but knowing the three stages of sepsis, what is sepsis, like what have you heard about it? Let's break up the myths. So just being very simple, empowering, entertaining, and fun. And a lot of times when I do education, because one thing that I realized about the community, regardless of your literacy level, whether it's from third grade or college and beyond, nobody wants to be embarrassed. Mm-hmm. And nobody wants to seem like or present like they don't know the information. So a lot of times what I'll do is I'll create a wheel. And like, say, for instance, if I'm an educator on heart disease, I'll create a wheel. And then I'll have signs and symptoms or everything that's a part of heart disease on the wheel. And then when they spin the wheel, wherever they land, that's the answer. And then that's where I will give them the education at. And then they will be able to share it to their loved ones or their family. So just making it simple and fun, giving them the points they need so that when they do go to the physician or to the medical centers, they can articulate and communicate exactly what's going on and not feel embarrassed.
I like that. I like what you said about making it simple and making it fun because as someone who also does community outreach, I know that people do not like it when you're just talking at them. But if you can make it interactive and make it fun and get them involved, I think it sticks with them a lot longer. Yeah, fantastic. So thank you so much. We are going to put you backstage for just a little bit, and I'm going to bring up Kim from Molina, but don't go away because we're going to bring you back. We have more with Nurse T. Thank you so much. All right, so now I would like to welcome our next guest, Ms. Kimberly Robbins from Molina Healthcare, and she is a senior community engagement specialist. Kim, how are you today?
I'm fine. How are you? Thank you so much for this opportunity.
Yes, thank you so much for being here. We so appreciate your time today. So can you please tell us about Molina Healthcare and tell us about your role there as well?
Okay, so Molina Healthcare and this is a great opportunity because I've learned from being in the community. A lot of people are not familiar with Molina, but Molina, we are a Fortune 500 company. They provide Medicare and Medicaid services, and we also provide insurance through the state marketplace. My job is community engagement specialist, so I'm the relationship builder. So I'm the one that's face-to-face with the community. So I build relationships with organizations, community-based organizations, and try to support any programs that they have that align with Molina's missions and values. So I work with various organizations like Hamilton Health Clinic, Healthcare Network, South Flint Soup Kitchen, Carriage Town. So those are some of the organizations that that Molina partners with to support their programs.
Okay. How long have you been working with Molina?
So I've only been with Molina for 9 months, but I've been in the healthcare industry for, oh my gosh, almost 30 years in various capacities.
Okay, wow. Do you want to share a little bit of your health background with us, please?
So I graduated from Grambling State University. My degree was in actually recreational therapy. I always knew I wanted to help people. That's just how I was raised. My mother was a big helper, a volunteer in the community. So I always knew I wanted to help people. So as far as recreational therapy, I was kind of, if someone tried to encourage them to get back to their previous leisure lifestyle. So we had a lot of people that, if they were bowlers or runners and they have a sudden accident where they can't do those things before, the way they used to, we would give them, modified ways to do that. I've also was employed with Hurley Medical Center for over 15 years. So I retired from there in 2015. And I've always worked in the inpatient rehab unit. And then I went to another healthcare company for 6 years, and then now landed at Molina for the last 9 months.
Okay, fantastic. I love to hear that. Now, I was looking at Molina's website, and I saw there that Molina describes itself as offering a holistic, community-based approach designed specifically to meet the individual needs of our members. What does that look like?
So Molina, we care a lot about our members. So whether it is providing and make sure you have a primary care doctor that can take care of all your health needs. We provide hearing aids. We provide free exams for your eyes every 2 years and free glasses. We also provide dental services for pregnant women. We want to make sure, that is something that while they're pregnant, that they have, good dental care. So from the time that Molina finds out that an individual is pregnant, they get dental up until the time of postpartum, which is like 12 months after they deliver their baby. Okay. So we also have programs to help individuals if they want to stop smoking, if they want to control their weight, or if they want to get help with chronic diseases. We have programs that can help them with those things. We also have care management teams. So the care management team are nurses and social workers that will give extra attention to individuals if they have behavioral health disorders, if they have high blood pressure, if they need that extra attention. We have the healthcare team that will be there and available Monday through Friday. And we also have the community connectors. So we also want to make sure that they can help improve the access to care. And so our community connectors, they are available for our members if they need finding housing resources, food bank locations, finding a medical home, support groups. So we have those connectors. So we want to just make sure that all of our members have all the care they need and that no one slips through the cracks.
I love that. You talked about some things that I guess I never thought about, like what you said about pregnant women and dental care. So that's fantastic. You guys really are doing a great job helping people in the community. Now, can anyone join Molina, anyone across the state, or is there a certain criteria that must be met to become a member? How does that work?
So there are certain criteria, but we always tell, individuals in the community, if they ask me, well, how can I sign up? I always direct them to either our, www.meetmolinamichigan.com website, or they can contact their local Department of Health and Human Services and then sign up through there.
Okay. Now, when we talk about accessibility, I know sometimes a barrier to accessibility, I believe Nurse T mentioned this earlier, can be transportation. People don't have a car, or maybe their medical provider is not near a bus route. Does Molina help with transportation at all?
Yes, our members get free transportation to and from any service that's covered under their Medicaid benefits. They do get transportation to and from those services.
That's fantastic. That is quite a nice bonus. Now, let me ask you another question too. We were talking earlier before we started this, and sometimes people can be hesitant to get the medical care that they need because they don't have health insurance. So let's say I'm a person who doesn't have health insurance, but I am having a medical emergency and I need to get to an ER. I can still go into an ER, correct? But is Molina able to help me with any sort of expenses that I'm going to incur as a person who doesn't have health insurance?
So you would have to definitely be a member, but we don't want anybody to be at home suffering. So you still go to that ER, your local ER. And then for those individuals who don't have insurance, the ER has social workers. So they have a social worker or a case manager that will come in, and then they can let them know, hey, I want to apply for Medicaid. And so they will help them apply for the Medicaid insurance and apply for Molina. So yes, not having insurance should not stop you from going to the ER if you need it. So you definitely go, and then you have the social worker or the case manager help you fill out for Medicaid at that time.
Okay, that's wonderful. And I'm guessing people who have children, they're also able to get their children insured under Molina, correct?
They can. Yes, they can. So
Okay.
yes.
Fantastic. All right, we're going to bring Nurse T back to the stage. I noticed, Kim, that you said you also worked at Hurley, so I know that Nurse T is no stranger to you. You both know each other, and you do several things together in the community, which I love. Also, looking around on that Molina website, I noticed that the Hurley Foundation just last year gave $10,000 to Molina for their Child Life program, and that's Molina donated to Hurley. Yes. I'm sorry, I said that backwards. So Molina donated to the Hurley Foundation $10,000 to their Child Life program. And that's a program that's designed to help children cope with being in the hospital. Does Molina and Hurley, do you all often work together? How do you collaborate in the community?
Yeah, well, it doesn't matter either one. So that's because we do work together so much. So that's just our way of giving of Hurley and Molina working together. Nurse T and I, on a monthly basis, we are together probably, 5, 6, 7 times. So she represents Hurley, I'm representing Molina. So we're coming together to educate the community, with her nurse background, and with me. One of the biggest things too is when we support an organization, sometimes it may be, donations. So we may be at a found organization, or be at an event, and let's just say little things like hand sanitizer or a mask. That's Molina's way of giving back, because we know that's still something that's prevalent, that's needed in our community, because they're, especially our seniors. So she may bring the education background. Molina, we're supporting the things and donating the things that sometimes individuals need while we're at these events.
Yeah, I can honestly say I love the partnership from institution to institution, or organization from organization. But I like it because it's a personable relationship, especially when you have Kim in the position that she's in, and then I'm in my position. So a lot of times, what we do, instead of trying to duplicate services or trying to outdo each other, because sometimes people can be in competition.
Mm-hmm.
And yes, I said that sometimes people can be in competition, but the one great thing about Kim from Molina and Tarnesa from Hurley is that we are not in competition. We are strategically working together to advance the healthcare outcomes of our community. So what that looks like, if there's any events that I have that Molina may have an opportunity to attend, I'm notifying Kim and letting her know that there's an opportunity for Molina to come in and set up a table, maybe sponsorship or whatever. And then it's same as with Kim from, it's like Kim from Molina. It's like a little rhyme going on. But like when Kim, there's an opportunity, she's always calling, me, and we can work together. And then too, we have been able to successfully go to like the jail, some of the local schools, some of the community events and set up. And we're even working more on education and bringing literacy to the community from the perspective of, from the hospital's perspective and the insurance perspective, because that's key.
Mm-hmm. Now, to go back to partnerships, I love to see partnerships, and I love that there is no competition, because what the both of you do go hand in hand, and they are both needed in the community. Now, Gift of Life has also been able to work with Hurley Medical Center. Hurley has been such a wonderful supporter of donation, and Hurley was actually awarded our Hospital of the Year a few years ago for all of their work with donation. Can you share how we've been able to work together in the community?
Yes, as far as the community, we've also had opportunities to be at events together and share healthcare information and share the spaces. The one thing about Gift of Life too, that the nurses, we all know about the Gift of Life program. We've been educated on it. If there's a time of a unfortunate incident and somewhere someone has, pledged to donate one of their organs, we all do the honor walk. We acknowledge that. We have education and, documentation that we fill out to make sure that our patients meet the criteria for Gift of Life. And then we also have a rep from Gift of Life to help service Hurley Medical Center. But I think the one unique thing about the relationship with Gift of Life, especially with Shalonda, is that you are so pleasant and nice. And I love the way that you reach out and try to create opportunities and try to bridge the gap so that we can all come together as a united front and have resources available in one place at the same time.
Mm-hmm. Thank you. Thank you. I appreciate that. I appreciate both of you. Kim, Nurse T, thank you so much for everything that you do for our communities. And you're making sure that people are educated and helping them so that they feel empowered to discuss their health, to obtain their health, to get the help that they need. And you're also helping supply them with medical insurance, because we can talk about health literacy all we want, but it can be difficult if we don't have health insurance. And I appreciate you making it accessible and affordable for so many people. I think being able to provide transportation is just amazing. So you're doing all that you can to take away any sort of hindrance or stumbling blocks that can prevent people from getting the education that they need. And I know that our community, we love everything that you all do. So thank you all so much. I look forward to working more with both Nurse T and with you, Kim, in 2023. So if you are in Genesee County, Please get ready to see these faces a lot.
Yes. They probably already have. So just continue to see us even more because we're already working on our 2023 schedule. So the calendar's trying to coordinate.
Yes.
And I just wanted to say we welcome, if I can speak from, the passion that I have, and, it's easy or easier to work with people in the community that have the same passion. A lot of time we say it's all about a team. And when we say that, a lot of people can say it, but when we can implement it or when it can be seen. So when we do come together and you can visualize, when the community can visualize and see the passion of how we care about the community, the teamwork is easy. So we welcome anybody else, if you have any kind of resources or any kind of contribution, to reach out to us. And Shalonda, I just want to applaud you for your efforts and let you know that I think that you are doing a fabulous job. And thank you for reaching out and connecting and, partnering with Hurley, and also giving me an opportunity to be in your space to help advance healthcare.
Thank you. I appreciate that. I thank both of you because I know that you're both very, very busy women. So I appreciate you taking time out today to join us today. And just to co-sign what Nurse T said, I can tell that what both of them, both Kim and Nurse T, there is a passion there. This is not just a 9-to-5 for them. This is something that they truly care about. They do love the people in the community, and they go above and beyond to make sure that people receive the help that they need. So thank you both so much for that. And I hope that you have an amazing day and an amazing holiday season. Thank you both for being with us today.
Thank you. You're so welcome. Thanks again for having me.
Of course. Thank you. Thank you both. Anyone watching, if you would like more information from Hurley Medical Center or from Molina, we would encourage you to go to their websites. They have been streaming at the bottom of the screen here. So I'm sure they would be more than happy to answer any questions that you might have regarding what it is they do for the community. And if you are someone who would like to become an organ donor, you'd like to join the Michigan Organ Donor Registry, or you have questions about organ donation, I would also encourage you to go to our website at golm.org. Thank you so much for your time today, and I hope that you have an amazing day, and we'll see you next time. Bye-bye.